Hello, and welcome to our first edition of our new podcast, Reading the Signs, with Dr. Jim Dolan and myself, Rick Hinshaw. Let's tell you just briefly about who we are and what we intend to do with this show. The name comes from Vatican Council II's Constitution on the Church in the Modern World, which told us the church has always had the duty of scrutinizing the signs of the times and of interpreting them in the light of the gospel. And that's what we want to try to do with this show. Look at different issues, different concerns out there, and talk about them in light of the gospel. With me, Dr. Jim Dolan. Jim holds a PhD in social welfare. He has had a 46-year career in the behavioral health field as a healthcare administrator, a psychotherapist, a college professor, and a child protective services caseworker. Jim has self-published 2 books and for 3 years hosted Recovery Road on Nassau Community College's radio station. He now authors his own blog, A Catholic Christian and the Everyday. And Dr. Jim currently is on the board of the Life Center of Long Island, where he also volunteers on the board of volunteers providing psychotherapy for women dealing with unplanned pregnancies. Jim, your thoughts on what we'll try to do here with this show?
So, thank you, Rick, for that introduction. And today, being our first show, our topic is going to be the topic of assisted suicide, sometimes referred to as physician assisted suicide. But the proponents of this cause, of course, are uncomfortable with any referencing to suicide or killing. So they use the euphemism or the understatement that they use, which is called, in their mind, the whole concept is referred to as medical aid and dying. And I'm only pointing that out because if we use those terms interchangeably, assisted suicide, physician assisted suicide, or reference medical aid in dying, just so you know exactly what we're talking about. But I also do want to make a quick reference to the prayer, the Our Father prayer. The Our Father prayer is very instructive, especially for me, the line where it says, "Dear God, please lead us not into temptation." What does that mean? Dear God, please do not lead us into temptation. What we are saying or what we are praying when we state that is that we are asking God to not allow us, to please help us to not use our God-like capacity to deny you. Please do not let us use our God-like capacity to overrule you and try to supersede you and to act as if we're God.
Thank you, Jim. Thank you. Uh, just to give my own background, I'm Rick Henshaw. I've had a more than 30-year career in primarily Catholic communications, been the editor of the Long Island Catholic newspaper. I also worked as communications director for the Catholic League and communications director for the New York State Catholic Conference. I was also public information officer for Nassau, the late Nassau County District Attorney Dennis Dillon. I was director of family ministry and Respect Life for the Diocese of Rockville Center. And I also co hosted a show on the Diocesan Telecare channel called the Catholic Forum. And I also host a blog site called Reading the Signs, which I've hosted for several years, and I write occasionally, usually at least monthly, sometimes more frequently, on issues of the day, cultural issues, public policy issues, sometimes on family life, moral values, and sometimes in internal matters within the church, with the idea of looking at these things from a gospel perspective, looking at them through the moral and social teachings of the Catholic Church. And that's what we're going to try to do here with this show, beginning today, as Jim said, with the question of assisted suicide. And maybe, Jim, you could take us through where there is a bill in New York State that passed last June and is still awaiting action by the governor. Maybe you could take us through the details on that, and then I'll reflect, on what some of the questions are, and then you can get into some analysis of this.
Sure, Rick. Let's go from there. So the bill has been passed by the state legislature and the two bodies of the state legislature, and it's with Governor Kathy Hochul at this point. She hasn't made a final decision, but she has floated some proposals. with regard to how she would like to see the bill modified. So let's look at some of those proposals. Her first proposal is that it would require that all patients who request life-ending medication to undergo a mental health evaluation by a psychiatrist. Her other proposal is that there be a mandating of a 7-day waiting period between the patient's request and receiving the medication to kill themselves. The bill, as passed, did not have a specific waiting period, though it does require that 2 physicians must sign off on the request, and those 2 physicians would be responsible for attesting to the idea that the person's condition is unchangeable and they are going to die within 6 months. The other amendment she would like to see made is that it would restrict the practice to New York State residents only. The other amendment she is proposing is that it would be requiring patients to videotape their request for the medication that would kill them. And her final amendment is that the bill wouldn't go into effect until 1 year after she signed the bill.
Mm-hmm. Mm-hmm. Well, it's very interesting that she's proposing these kinds of maybe modifications, but the overall bill obviously would still be the same, that people in the late stages of terminal illness would be able to request doctor assisted suicide to end their lives. And obviously, the support for this is based on the idea that this would be the compassionate thing for people who are in those end stages of life. But I have 2 immediate questions. The first one is this truly compassionate? Is it the compassionate response? And one of the things that I go back to with this, it was a number of years ago now that the Science Committee of the American Medical Association stated that many persons initiated discussion about suicide to evaluate the degree to which others are concerned about their well-being and to evaluate their own self-worth. And Pope St. John Paul II, in his Gospel of Life encyclical, wrote that oftentimes request for suicide is above all a request for companionship, sympathy, and support in the time of trial, a plea for help to keep on hoping when all human hopes fail. So maybe some other questions with this, but maybe pick up on that, Jim. Do you have any reaction to that? What is the truly compassionate response?
Well, thank you again, Rick, for the handoff. Let me look at for a moment with you what the Catholic bishops had to say about the amendments proposed by Governor Hochul. What they say is that the amendments don't change the fundamental truth that this bill sanctions suicide, and it diminishes medicine, meaning medicine as treatment, forever, and is guaranteed to lead to tragedies, mistakes, and unattended consequences. I want to take a half of a step back and talk about what is put out there from time to time by supporters of Kathy Hochul, and they like to say, but she's a Catholic. But what we do know about Kathy Hochul from her position on abortion is that she is not aligned with Catholic teachings on the sanctity of unborn life. Therefore, without her being grounded in the belief in the inalienable right to life, and based on her proposals related to assisted suicide, and since her priority is actually politics, her approval of assisted suicide is inevitable.
Yes, and let me pick up on what you said because the relationship to abortion here, there are those who think that the church's commitment to life begins and ends with abortion, and the church is often accused of focusing almost exclusively on that issue. But that is not the case. The Catholic Church is not pro-life because she is against abortion. The Catholic Church is against abortion because the Catholic Church is fully committed to the sacredness of every human life at every stage of existence. And today, obviously, we're talking about the other end of the life spectrum at the end of life. But there is a connection there. I might point out that Father Dan Berrigan, the late Jesuit peace activist priest, And he was very consistent, agree or disagree with his approach to war and peace issues. And he would get arrested sometimes at military installations or weapons factories. But he also got arrested several times outside of abortion clinics trying to sit in to save lives there. And he said one of the reasons that he was opposed to abortion was it would inevitably lead to euthanasia. And we see with the abortion, as we've talked about, Jim, is uh, the major push for abortion these days is a woman's freedom of choice. But it's also been held up over the years as its own form of euthanasia to abort those with disabilities before they're born, to prevent them from being born, is supposedly a mercy killing for them. The idea that child abuse would be greatly reduced if abortion were legalized and unwanted children didn't come into the world. You've dealt in your career with child abuse issues. You know it's a much more complex issue than that. But in these areas, there was always a kind of a euthanasia approach to the killing of the unborn, and now we see it in end of life issues as well.
Yeah, I do want to speak more about the eugenics or the genocide related to these topics, whether it's assisted suicide or and abortion. I want to point out something that's very interesting. 11 of the 12 jurisdictions in the United States, that being 10 states and the District of Columbia, that constitutes the 11 states. 11 of the 12 jurisdictions that have legalized assisted suicide are what are referred to as blue states. These are liberal states. The one red state that has legalized assisted suicide is the state of Montana. But let me tell you something about the difference between blue states and red states. It is very interesting that the population growth in red states far exceeds the population growth in blue states. It is also very interesting that birth rates in red states are far greater than birth rates in blue states. Now, factors such as job opportunity, housing costs are factors in population size, but the blue state greater embracement of the culture of death is also a factor.
Mm-hmm. Yeah, this is, and those are undoubtedly states that even with the overturning of Roe v. Wade have maintained a probably limitless access to abortion. Jim, the the question of this being limited, and Kathy Hochul proposing even more kind of safeguards to it. But the idea that it would be limited to only those in the late stages of terminal illness. But that's not been the experience of other countries that have had legalized euthanasia and assisted suicide for longer than we have. The Netherlands has had it for some 50 years, and Canada more recently. And there, the practice has spread to encompass people who are disabled or mentally ill or beset with very real but not necessarily lethal crises, loneliness, depression, poverty, homelessness, substance addictions. And what's interesting is that here in New York, when the bill was voted in, it was primarily a Democratic bill. And we have an overwhelmingly Democratic state legislature, but not all Democrats voted for it. And here on Long Island, three Democratic legislators voted no. They were all women of color whose districts include economically disadvantaged minority communities. And one of them, Senator Cielo Bino of Westbury, warned that this bill may disproportionately affect vulnerable communities that already encounter challenges, including poverty and discrimination in accessing health care. You've spent your whole career working with vulnerable populations. Are you concerned that this bill could be very expansionist and could ultimately be making assisted suicide available and making people feel pressured into it when they're suffering from mental illness or material poverty or substance addiction, and not just in the late stages of terminal illness?
That's a great point, Rick, and I do want to elaborate on that in terms of my response to the point you're raising a little later. But what you're again touching on is the topic of eugenics. Let's give a little definition for the moment of what is eugenics. Eugenics is a belief system that is used to justify genocide. That being the killing of marginalized groups of people based on subjective definitions of fitness and worth. And certainly, people in the minority community have always felt that their lives are valued less than people from they might refer to as the upper class. I want to also step back and provide a little bit of a overview of the issue and ask the question out loud: is how did we get to this point, or why are we at this point that we are once again treating treating an issue that feels like a great challenge with the supposed solution of killing? So I'd like to ask myself, how did we get to this point? What was the process for getting to this mentality?
Oh,
Well,
I'm
if
sorry.
I like just finish that,
Sure.
that thought, and then I'll ask you to do a jump off from that, Rick. It can be traced back to the Old Testament when Cain killed Abel. From Cain's point of view, this was very justifiable. He did it for a reason. He did it to, in his mind, solve a problem. So, but the other answer is that humans have always been tempted when faced with a life challenge with choosing between a destructive life with with choosing between a destructive problem solving approach and one that is life affirming.
You really anticipated my point, which is, and I would go back to, again, the abortion mentality, which the church has long been warning would lead beyond the killing of the unborn, as horrific as that is, and the numbers that are killed. But I've always said what it clearly is, the abortion mentality promotes solving issues of human suffering by destroying the victims of human suffering, not the causes of human suffering. And I think, again, we see that with trying to do away with the disabled or those with mental illness or limiting the population growth of those who are poor. And here at end of life or other suicidal moments, well, just let them go. These are people who'll be a burden on the rest of us if they continue to live. So we solve the problem by getting rid of the victim of the problem. Jim, let's talk about the church consistently on pro-life issues always also looks to promote life-affirming alternatives. You're working with the Life Center, again, in the area of abortion to help women to choose life, to solve whatever problems they might be facing in an unplanned pregnancy that might lead them to abortion. Here, we know there are positive, the idea of palliative care, effective pain management, hospice care for people in the late stages of illness, support for caregivers so that family members and others who are giving care can get some relief and some help. And the church does this in its own facilities with parish social ministry programs that give support to caregivers, helping for people in these situations to experience the loving presence of family, friends, community, and that pain management aspect. Yet, I was surprised to learn that the Hospice and Palliative Care Association of New York State has said that New York has consistently ranked behind the rest of the country in this kind of care.
Wow.
So I would like to see Governor Hochul, instead of trying to find ways to doctor up this bill so she can be comfortable signing it, give priority to catching New York up with the rest of the nation in developing this kind of effective, compassionate palliative care for those with terminal illness.
Well, thank you, Rick, for that lead in once again. So, what we're dealing with is a culture of death. And in modern times, this is evidenced, as we've been talking today, through the practice of abortion, euthanasia, and assisted suicide. All three killing options are used to address what they deem as a life problem. So, the alternative is to foster a culture of life that respects and protects all life. Although the proponents of assisted suicide, euthanasia, and abortion are facilitators, and as I've kind of mentioned in my opening remarks, of the culture of death, they are uncomfortable with the references to killing and to the term assisted suicide. So they like to use the term medical aid in dying. But what I do want to talk a little bit about how they have lost their way because what's underpinning their arguments are assumptions that are based on falsehoods. The first assumption that they have is that there is no God. Their second assumption is that life is not a gift that we have a responsibility to protect. Their third assumption is that someone other than God has the right to determine whose life is worth continuing. Their next assumption is that not all human lives have value. The next assumption is that society should not be structured to ensure that all efforts and resources are used to support and protect human life, especially the lives of those who are most vulnerable. And their final assumption is that suffering is not a part of life. So this reminds me of one of the very, very first lessons that we were learned. And it brings me back again to the Old Testament, and that being the story of what took place in the Garden of Eden. It was in the Garden of Eden where Adam and Eve got to the point in their thinking where they were influenced by evil and the devil to conclude in their mind that they could supersede God. They thought that they were greater than God, that they could be greater than God. And we know what happened as a result of that. All hell broke loose, so to speak.
Yep.
So go ahead, Rick.
No, absolutely, and I think today we have a hardcore secular humanism that has so greatly influenced our culture that rejects the idea of God or any higher law. And of course, one of the things to keep in mind is that they will tell us, well, you can't. You talk about God, you're imposing your religion. A lot of people don't believe in God, and we shouldn't be controlled by your laws. But there are 2 points here. First of all, we have as much right to bring our values to the public square as others who have different beliefs or no religious beliefs. So, as Pope John Paul said, what we do as Catholics is to propose, not impose, but we get in these discussions and we propose our life affirming approaches to all of these issues that the culture of death approaches by seeing who can be allowed to die or who can be killed to solve a certain problem. And we have every right to be part of that. And the founders certainly included the natural law, which informs Catholic moral and social teaching, was invoked by the founders in the Declaration of Independence, the right to life, to liberty, and to the pursuit of happiness, taken directly from the writings of John Locke and going back to the early Catholic thinkers and the Greeks in terms of a higher power that set in motion a natural law that's discernible to all of us through the gift of reason. And people can choose not to believe that, but we have every right to invoke those things. It's not the same as saying we're going to use the law to require that people go to Mass on Sunday regardless of their beliefs. That's a religious practice. This is bringing religious values into the discussion of public policy and cultural issues where the church has a great deal to contribute from the depth of its moral and social teachings.
Excellent. Well, let's touch on the topic of extreme circumstances and the people who disagree with Rick and I, who feel like we should not be making absolute statements about human life, that all human life has value, because they uh, object to that because they feel that at the end of life or at the beginning of life, in their mind, human life really does have less value in their mind. But the truth is that the culture of death, that culture of death kind of thinking can be changed. It can be changed. How is that changed? Well, Rick, just a few moments ago, you were referencing the pregnancy care centers, also known as life centers. Mm-hmm. At life centers, women come to those locations. They're in desperate need. They are in desperate straits. And what happens is that when they are surrounded by love, when they're surrounded by compassion, and they're surrounded by truly helpful support, it almost always happens that their hearts and minds are converted and they choose life. So within a culture of life, hearts and minds do get changed. The culture of death that we live within to a large extent is influencing people to err on the side of death. For the terminally ill and their loved ones, they too will choose life when they are recipients of support that is reliable, consistent, loving, and truly helpful. So you mentioned about the life centers. Let me just tell you very, very quickly about the free services they provide. They provide free sonograms. They provide free sexually transmitted disease testing. They provide free legal help, free mental health counseling, free access to all the diapers, wipes, and formula that they need, and car seats, free referrals to medical assistants or to specialists in medical care, to Medicaid, and to other what we refer to as wraparound services, such as housing and WIC services, women, infant, and children services that are available through local government. When women, I just was talking to a woman yesterday who just happened to drop into a life center. She's 3 months pregnant and was considering an abortion. And she called me up and said to me, I didn't know you guys existed. I'm feeling different already about what I was considering because of how loving and supportive and how much hope you've instilled into me.
And I think it'll take another show, but we'll be talking about what the government is trying to do in going after these pro-life centers, because it's really scandalous what they're trying to do and distorting what these centers do and trying to undermine them. Maybe we'll just conclude with, if I could, getting back to the question of assisted suicide. The idea that people in those terminal stages, their lives, for all intents and purposes, are over. They're a burden to others. They're suffering. Uh, One of my early assignments as a reporter for the Long Island Catholic back in the 90s was to go to Mercy Hospital, at Catholic Hospital here on Long Island, to meet with a man named Ed Keir and his family. Ed was suffering from Lou Gehrig's disease. He was in about the fifth year of it then. He would live 10 years. And it was incredible. He couldn't speak. He was flat on his back. He had learned to dictate words by flicking his eyelids, and his family could pick this up. And the day before I got there, he dictated a 3-page letter to me doing that, and he explained how he was in a deep pit when he first, got this disease and started to debilitate from it, and only by his family being there and rallying him that he came out of it. There was only he and his wife and his children, people of strong faith, but he still struggled with this. But he came out of it, and when I went there, it was like a family gathering in a suburban home on Long Island on a Friday night. He and his wife, his adult sons and their families, grandchildren running around, and they told me how, being there for him had brought them all closer together, strengthened their faith. Friends, people in the community, people in the church, and then the word spread out really around the country, and people were brought to the Catholic faith through him, and he was offering his suffering for others and for the souls of others, and then using himself as witness to speak out for life, writing to the governor against the death penalty, writing to Ann Landers and Dear Abby against assisted suicide and euthanasia with his own testament of his own life, writing letters to the editor about abortion. So this man, flat on his back, unable to move or to speak, the people would have said, oh, his life was over, he should have been able to end his life. And if you think of all that was lost in the lives of so many people, if he didn't have those years to touch their lives, and all that would have been lost, the joy in his life as he adjusted to this and refound God and his family, and the idea that we can make a judgment that a life should end, rather than what the church teaches, that every life has meaning and purpose for as long as God wills that life to continue to exist.
And if I could just make one very quick closing comment, that's a wonderful story, Rick. And I want to just say that we are all called to be heroes. We are all called to partner with God in overcoming the anti-life forces. and be willing to sacrifice ourselves in the process. Doing so is the only true path to fulfillment.
Thank you, Jim. That concludes our time for this week. We'll be doing this show every 2 weeks, a bi-weekly show, and you can find us. We'll be emailing out if you're on my Reading the Signs blog list. Getting my emails on the blogs, you'll be emailed the link to these shows. Otherwise, you can go to rickhinshaw.com or Rick Hinshaw Reading the Signs on Google, and you'll find that website, and you can find this, and we'll also have it up on YouTube on a Reading the Signs site on YouTube. So thank you for joining us. We hope you enjoyed the show, and we'll come back and watch us again.